This video is going to be aimed more at heart, things related to heart, and maybe even some little tips to try to prevent heart issues. But the first one is pistachios. It actually lowers pulse wave velocity, so it has a beneficial effect on PWV, which is a measure of arterial stiffness. So lower PWV indicates more flexible, healthier arteries, reducing cardiovascular risk. So basically, pistachios are rich in unsaturated fats, monounsaturated fats, and polyunsaturated fats, so that they can reduce LDL cholesterol while also increasing HDL cholesterol. Now, the reason that's important is when LDL cholesterol is too high, is that it actually in the arteries, macrophages come around, and then they start to engulf the oxidized LDL, and then that creates foam cells, and then foam cells create inflammation, and then that inflammation attracts more macrophages and engulfs even more oxidized LDL, and then it just perpetuated, so it just gets worse and worse. The pistachios also contain polyphenols and vitamin E. Also, vitamin C regenerates vitamin E, so this reduces oxidative stress and inflammation in the vascular endothelium. So to stop the attraction of the macrophages and the oxidized LDL in the first place. Also, regular pistachio consumption also reduces systolic and diastolic blood pressure. Lower blood pressure decreases mechanical stress on the arterial walls, contributing to lower PWV. And pistachios can also blunt postprandial glucose spikes because reduced glucose variability lowers advanced glycation end product formation, which can actually stiffen arteries. Now, a good way to reduce advanced glycation end products to protect your heart is with cinnamon. Better off with a Ceylon cinnamon, because they're rich in polyphenols like cinnamaldehyde, which scavenges reactive carbonyls and free radicals, slowing down the formation of advanced glycation end products. Cinnamon directly inhibits the chemical reactions that lead to age formation on proteins. Cinnamon also enhances insulin sensitivity and glucose uptake, and that's important for the vitamins to actually absorb to prevent diabetes in the first place, to prevent inflammation. That's one simple way to reduce advanced glycation end products. So pistachios also contain several classes of bioactive molecules that can impact endothelial function, platelet behavior, and this has to indirectly influence the fibrinolytic balance. Catechins, flavonols, and anthocyanins in pistachios decreases the oxidation of fibrinogen and plasminogen. Also, less oxidized fibrin, because which means it's more susceptible to plasmin digestion and enhanced fibrinolysis. So fibrinolysis is basically the reversal or the degradation of a plaque buildup, or at least trying to reduce that. Enhancing nitric oxide reduces platelet adhesion and thrombin formation, indirectly shifting balance toward fibrinolysis, which is a good thing. Pistachios are also rich in vitamin E, which is an antioxidant of lipoproteins and fibrinogen. It prevents formation of tightly cross-linked oxidation hardened fibrin clots. More normal fibrin is easier for plasmin to break down. Pistachios are also known to have reduce the aggregation of platelets, because antioxidants in pistachios can prevent oxidative modification of platelets in LDL, which normally promote aggregation. So that this shifts the balance away from thromboxane A2, and because thromboxane actually promotes the aggregation of platelets. Now, one good way to influence or to work with thromboxane, there's a lot of ways, but this way is one is with peaches, because peaches are rich in polyphenols like chlorogenic acid and catechins, and vitamin C, which regenerates vitamin E. And they both have anti-inflammatory and antioxidant effects. So the peaches can reduce NF-kB activation, which is a key transcription factor for VCAM1 and ICAM1 expression. This reduced oxidative stress actually lowers endothelial activation, which leads to decreased VCAM1 and ICAM1 expression. So some animal studies have showed that foods such as peaches that are rich in polyphenols show reduced VCAM1 and ICAM1. So basically, TXA2 is a platelet-activating lipid mediator. High levels are prothrombotic and contribute to cardiovascular risk. And peaches contain carotenoids and flavonoids, which can inhibit TXA2 synthesis by inhibiting TXA2 synthesis, which is short for thromboxane, that inhibits platelet aggregation. So this leads to lower platelet activation and a slightly reduced risk of thrombosis. Another good one to use is Pears. Reduces VCAM1, ICAM1, and thromboxane A2, leading to less risk of atherosclerosis. Pears are also good for cancer. When it comes to cancer cells, when they're trying to evade, when they're trying to block the eat me signal, or they turn the eat me signal on so that the immune cells can't see the cancer cells. So basically, Pears also help with that. So if you have any more knowledge about a heart, if you know of any other foods that could reduce thromboxane, leave it down in the comments. Like, subscribe, and share, and I'll see you in the next video.